So, sorry about the lighting in this video. I know it's absolutely god-awful. It looks like it was something from the Blair Witch project, but everyone else is asleep, so I don't think it would be right for me to set more lights up or to turn on more lights just to try to get a better camera effect for a video that's mostly based on what I say rather than what I look like. So, here we go. This is about healthcare and public healthcare. So, I am not a proponent of public healthcare at all. When I say public healthcare, what I mean when I'm talking in this video is a government-funded program where that's where everyone pays for their medical bills. I'm not a fan of that at all. Why? Well, it's because I don't think it's right to take someone else's money and just give it to someone else. I am absolutely fine with charity. I am absolutely fine with people setting up GoFundMe accounts or anything like that. For instance, there was a family in my workplace recently that their son was in a pretty bad accident. He's about, I'd guess, 10 years old, and the doctor said he was basically gonna die. And a bunch of us at work ended up putting up some money together, and we were able to help that family pay for the treatment he needed. And that little boy, his dad actually got clearance to bring him to work the other day. He's walking around talking everything like a regular 10-year-old boy. Whereas before, the doctor said he would never be normal again or that he would die. So, I'm not against charity. I'm not against helping other people out voluntarily. Now, I do have a problem with people being forced to help other people with things. So, let's say that I decided within the next couple weeks that I wanted to get PRK. That's something that's been a big thing of mine. I want to be done with my glasses. I hate them. I constantly have to adjust them. I have to go in to get my eyes checked every year. And I have to go get a new prescription. And it's something I have to have. I can't drive without them. I can't work without them. I can't watch TV without them. I can't read without them. I can't... basically, the only things I can do without my glasses are eat and sleep. I have a hard time talking to other people without my glasses because I can't really see their face. They're just blurs. That's how bad my vision is. So, let's say that I decided to go get PRK next week. Who wants to pay for my PRK? You know? Why would I expect other people to pay for it for me? That's something that is my problem. Why would I expect other people to pay for it for me? Because, to be honest, if you look at how government-provided healthcare works, that's what it would be. The taxes would go up, which they have with Medicare. I can show you on my leave and earnings statement. And yes, when you work for the government, even as a civilian, you still get a leave and earnings statement, even if you're not in the military. So if I look at my leave and earnings statement, I have bits of my paycheck taken away to help pay for other people's health problems. Why should I pay for their health problems? It's not my problem. So why am I'm literally being forced to pay for their problems. It's not a thing of choice. I do help people when I can. I help people as often as I can. But why am I being forced beyond that to help people I don't even know or have never seen or may not have any interest in helping? Maybe I think they're fucking douchebags that need to deal with it themselves, you know? So, I think I've found something that would be a compromise. It is, let me pull out this note real quick. It is called a health savings account. So, from when I don't know if all federal employees get this. I know that employees on base have this. It's an account you have where you can put money into. And from what I understand, The you can put whatever amount you want into that account, and then the government matches up to $300 each month on that. So let's say you're putting $300 in each month. The government would match that every single month. So rather than it going to a government insurance or anything like that, rather than only saying you can only see certain doctors, which is what happened under the Obamacare, was you couldn't keep your own doctor, which is what was promised under Obamacare. You couldn't keep your same health providers. You couldn't keep your own doctor. A lot of doctors opted out of it. So under this, it's not a thing of the government is paying them. It's a thing of the government is paying you. You have this account, and they'll match up to $300. So if you want to put more in, yeah, that's fine, but they will match up to $300. Now, I know that it's still a thing of, yes, some taxes will go to it. So you still basically are taking money from other people to pay for other people's health problems. However, it's a thing where those people that money's going towards are also helping themselves. It's not a deal of, I have this health problem, so everyone else should pick it up for me. It's a thing of, I have this health problem, and I've been putting money into this, so money is coming out of that, but also I have this assistance as well. So perhaps we should be looking at something like that, as opposed towards free healthcare for everybody. Because to be honest, there is no such thing as free healthcare. There's no such thing as free college. There's no such thing as free anything. Any service to be provided has a price. And that price will be paid by you or somebody else, paying for you out of their own goodness of their heart, or because they're being forced to through either taxes or any other thing. So why do I think this is a good compromise? Well, you still have the thing of to be honest, I don't think we'll ever get rid of Obamacare completely. I don't think we'll ever get rid of some program where people are required to pay into it to pay for other people's health issues. We'll never get rid of that, because people see that now as a right. People see that they have a right to someone else's money to help them with their problems. I mean, the government pays for all kinds of other shit we have, right? Like education. Which, by the way, the government pays quite a bit of money to colleges already. So I don't get where this whole thing of people need free college, because the government's already paying for paying colleges quite a bit. Federal money, tax money is already going to colleges. I don't know why people want to raise that further, but anyway, this isn't what that's not what this video is about. This is about healthcare. So why do I think this is a good compromise? Well, it's not a deal of us helping people that aren't willing to help themselves. With this type of account, it is people that are willing to help themselves that are already working towards that. It's an account that it's almost rewarding people of putting money aside for health problems. So let's say that I want PRK, which I do. So I would start up an account with this, and rather than it taking me X amount of time, they would cut down that time quite a bit. It's not paying everything for me, I'm still paying money into it. So I'm not just trying to freeload off of people, I'm getting assistance from people. And yes, once again, I do understand you're still taking money from other people to pay for this sort of thing. So, I am against other people paying for other people's shit. I'm absolutely against that. If I had my way, this wouldn't even be considered. It'd be, you pay for your own you pay for your own health care, you pay for your own health insurance. That's how it works. But I can understand that we'll never again get to that point where we will never get to the point where no one has taxes taken out to pay for someone else's health. So, as a compromise, why not just do it through these accounts? It'll only pay. The money will only go towards people putting money into it. So people will put in however much they want into the account, and the government will match up to a certain point. So it's not going to be, this person has never planned ahead, this person has never had insurance, this person has never set any money aside to take care of his problems or her problems, and then everyone else has to deal with it. It would be, this person has set money aside and has planned ahead and whatnot. It's just that he's getting a little bit of outside help. So maybe that'd be a good compromise. So how are ways that we can pay for it? To be honest, it wouldn't be a thing of, it would be a thing of how can the government afford to cover these costs, but to be honest, it would be on the citizens too. Because the only people that would be covered under this would be people that put money into that sort of account. So how can we defray government costs? I would say do away with Social Security completely. Let's say that everyone born after 2020 no longer receives a Social Security number. They no longer are forced to pay into a retirement program that they will probably never see the money of anyway. Because as it is, because Congress has decided that they can pull money out of Social Security to pay for something else, I doubt that most of the people my age, I'm 26, most of the people my age will probably never get a fucking cent of what we've been paying into Social Security for all these years. We probably won't see a fucking cent of it. So completely do away with that. Do away with what's basically an extra tax. And just promote the shit out of this thing. Make it completely voluntary for people to put money into this thing. Promote the shit out of it. Also take away the taxes that we are currently paying towards Medicare. Take that away completely. So what the money that's coming out of people's Social Security and Medicare can go towards this account to help pay for their medical costs. If people want to make such a big deal of, well, how am I going to retire without me putting money into my Social Security? Well, that's your fucking problem, not anybody else's. If you have to, work until you're fucking 85. I don't give a shit. There's plenty of retirement options out there for people. Not just government jobs, private companies do that too. So, deal with it. I would say the same thing about this health shit, but it's not going to go away. I will always have to pay for someone else's shit. So, this is a compromise that I'm putting out there. So, it'll allow people to put money aside in case things happen. And, allow people to put money aside in case things happen. And, to me, it seems like it would help quite a few people to be able to pay for expensive surgeries like PRK, or let's say that a lady has to have her breast removed because of breast cancer. Maybe that account could help pay for to have artificial breasts put on if she deems that she needs those. Or let's say that that a kid gets in a wreck and loses all brain function. That account could help pay for a lot of that, because over the years there'd be quite a bit of money put in there, with that family putting money into it and then the government matching up to a certain point. There'd be quite a bit of money put in there. So rather than making it to where the government pays for anything and everything, make this type of account a thing. Because to be honest, we've already seen how socialized healthcare works. Now, I know a lot of people, if I start pointing at other countries, are going to whine and bitch and complain. So let's look at our country. Let's look at the one, I guess, second example of socialized healthcare in America. The first would be Obamacare, and that hasn't really worked very well. Every single promise that was given has fallen through. It was promised that we'd keep our same health provider. That didn't go through. I was uninsured for a while, yet I was still paying taxes into this Medicare program, and yet when I had problems and I needed to go get antibiotics, I didn't get any help from that program. So what fucking good did that do me? None at all. So the main one that I wanted to bring up is the VA. That's a very big example of socialized healthcare in America, in our own country. A lot of people are that the VA is covered through tax money, so a lot of people are being forced to pay money into that. People that use the VA for their health care, they're being covered under the VA. But the problem is, they aren't really being covered. We get told how great that our veterans get taken care of and whatnot, and yet when you actually look into it, they don't get taken care of very well. I have a friend that I work with who's dealing with some problems that the VA should be covering, and yet he asked for help 5 years ago, and yet it was only 2 years ago that they even looked at his file. Less than 1% of our population joins the military. So that means less than 1% of our population qualifies for healthcare under the VA. So if less than 1% of our population can't even get coverage from that, what makes you think that our entire population can receive adequate care and support for what they need if everything was socialized healthcare? It won't work. It won't work at all. Once again, I don't think anybody should be paying for anybody else's stuff. If you have a health problem, you should have to pay for it yourself, or your insurance company, that you are paying yourself and not forcing other people to do it for you. And again, I'm not against charity. I'm not against other people helping other people. And like I said, I do it as often as I can. But I think this could be a good compromise, because it's not going to be a thing of you're helping every dimwit out there that decides to make a bad decision. You're helping people that are trying to help themselves under this program that I've suggested. You'll have people paying into that program, and then the government matches it up to a certain point. So this money will be saved up that can pay for their medical needs. So, just a thought.